if you look at the number of undiagnosed pre-diabetics, there's that is close to a third of the population, and people say it's even higher. We just don't recognize it very well. Pre-diabetes is kind of people think it's genetics and you let it pass and you ignore it. But it does turn into frank diabetes at the end of it. So the scale is massive. And you can imagine these kind of numbers when you see the amount one has to spend in controlling diabetes.
Yes.
You're going to bankrupt society in general. So it's a massive number, really.
Elizabeth has asked if you could just elaborate on what is meant by frank diabetes.
Frank diabetes means you have the clinical syndrome of polyuria, polydipsia, and unexplained weight loss with one of these other criteria at least. So you have to have at least one of them, but usually all four are present. So it's not as if somebody will have a random blood sugar that's really high, but the HbA1c. So they all go in tandem together. So that is frank diabetes. Pre-diabetes is something just under those numbers. So pre-diabetes generally is 42 to 48 HbA1c, for instance. That would give you a clinical picture of pre-diabetes. And there are various markers that indicate pre-diabetes to people.